The Upstate Cord Blood Bank is a not-for-profit public bank located in Syracuse, New York. We are one of only 2 public banks in New York State. We started receiving donations in 2017 and have received over 820 donations from families who have delivered at participating hospitals in this area. There is no cost to donate. We test and cryopreserve the cord blood right here at our facility. Our goal is to make those units available to patients who need a life-saving transplant.
Cord blood, Patty.
So cord blood would be the blood that would be left in the umbilical cord after the cord is clamped and cut and the baby is taken away to be cleaned up. That would be the residual blood left behind.
And then what we do is...
So that residual blood would be collected, and in that blood contains stem cells, which could be used to treat up to over 80 different diseases.
And so it's our job in the lab, what we do in the lab is we take that blood and we separate those stem cells and then we put them in the freezer so that they're useful for the future.
Mm-hmm. And some of those diseases that could be treated from cord blood would be leukemias, lymphomas, blood disorders like sickle cell anemia, beta thalassemia, Fanconi's anemia. There's also a lot of studies with regenerative medicine, maybe uses for autism, cerebral palsy, stroke.
Lots of neurological things. So we are collecting stem cells, cord blood stem cells from the baby's cord blood. And these stem cells, just like Patty mentioned yesterday, will grow into other red blood cells. They'll grow into also nerve cells and cardiac cells. That's some of the research that's being done now. But what's important is your baby's cord blood could help others to have their diseases cured and helped out.
So I just wanted to start off by saying we greatly appreciate your time and consideration in donating your baby's cord blood. It's a fairly simple process. It may only take up to 20 minutes of your time. So I'm going to go over kind of the forefront process of getting your documents completed into the hospital. At your very first prenatal visit with your OBGYN, you're going to receive a RAC card that looks like this, and it's going to outline the amazing benefits of cord blood donation and the life-saving treatments that it can provide. Further into your pregnancy, around 28 to 36 weeks, you're going to receive our cord blood donation guide, and this is going to contain all the paperwork necessary to donate your baby's cord blood. Inside, you'll find the informed consent and also the health history questionnaire. It may seem daunting at first, but again, it should only take about 20 minutes, and the questions are very similar to what you would see if you were donating whole blood to Red Cross. Once you complete all that paperwork, we want to ensure that this is as easy as possible for you, the hospital, and your office staff. So they'll give this to you to take home after your appointment prior to delivery. We've included a self-addressed and stamped envelope for you to be able to send it directly to our facility. And once we receive it, we will review all the paperwork and make sure everything's completed, and then make sure it gets over to your delivering hospital prior to delivery. You should, I recommend speaking with your doctor, letting him know that you want to donate. He might also be able to answer some questions, but any questions or concerns, you can definitely contact us. You can find our website, email, and phone number inside all these documents.
When you arrive at the hospital for your delivery, you want to notify the nursing staff and your team that you're donating the cord blood unit, and they will get your paperwork and they will draw your blood with your admission blood work, because we need special tubes for testing for all cord blood donors. And they will ask you to review your paperwork to make sure there's no missing answers. If if there's anything that needs to be updated, we can update it at that time.
So umbilical cord blood donation is really without risk to either mom or baby. It's just part of the normal delivery. There is a delay while we're waiting for the placenta to detach, and that's when the cord blood is collected. It's not blood that's coming out of baby or out of mom. It's blood that's just going to be thrown away. The intent with cord blood collection is that there not be any change to care for mom, baby, the delivery, from what is the best according to what mom has planned and what the care provider has planned. If mom wants to have delayed cord clamping, that's fine. The American College of Obstetrics and Gynecology actually recommend a 30 to 60 second delay. And with that delay, there is no loss in what it would be collected for that stem cell collection. Delays longer than 60 seconds, we do see decreased quality of that collected unit, but you can still donate those cord blood units. There is just a decreased chance that we'll be able to use it for bone marrow transplant.
I think every mom-to-be should consider donating cord blood, their baby's cord blood, because it's a medical waste. It's gonna be thrown away anyway, and if you come to think of it, it can cure 80 plus diseases, and from the first day of the baby, he can or she can do a miracle, and there's no risk and there's no cost in donating. And I think it's really good that everyone should consider it.